Hey, good evening, good evening, good evening, good evening, good evening. Welcome to Dr. Jeff Experience. Tonight, you are in for a heck of a show. We are live tonight, live on Facebook, live on YouTube, live on LinkedIn. So go ahead and start tagging some people. I'm going to start tagging some people right now and letting them know you need to be a part of this. Tonight, we've got a subject that, whew, boy, I wish someone would have taught me about this a couple years ago. And but I want to help the brothers. I want to help the brothers, and I've got tonight. We're going to talk about menopause and how men can help the sisters with this menopause, their wives, their loved ones. And I've got my resident expert with me. She's a nurse of over 40 years, and we have experienced this phenomena.
Personal experience.
Personal. Yeah, we've experienced it personally, and tonight we're going to talk about it. We're going to talk about it tonight. So go ahead. Um, while we are talking, matter of fact, go ahead, Karen, introduce yourself. Talk about a little bit of background of your nursing career while I
Oh
tag some
my.
folk.
Okay. Well, again, I am the other half of the Fauntleroy. Um,
The better
I don't know about better, but I think we're equal. Anyway, again, my name is Karen Fauntleroy, and I am a nurse. I graduated from nursing school in Philadelphia in 1985.
That was a long time
that
ago.
was a long time ago. And so I've had various nursing experiences. Um, my first experience was in the hospital in many different departments, as well as once I met this young man and moved to New Jersey, then I had experiences in mother baby, in OBGYN, um, and other various experiences. So, a multitude of nursing experiences, um, which I enjoyed. I am now retired and glad to be retired, and now looking for my next assignment. So, welcome everybody. I hope you enjoy this session of the Dr. Jeff Experience. It should be interesting. I hope it's informative. I hope it helps somebody. So let's get started.
Yeah, so let's get right into this. What is menopause? Let me tell you, brothers. Man, you ought to know about this. And but on a serious note, you really need to know about this. This is why, and this is from a discussion that I remember having years ago with some men at my church in New Jersey, and some brothers were talking about some things, and it was just that question that we asked: "Hey, bro, how you doing? Hey, bro, how you doing?" It's like, "Man, not good, not good, not good." It's like, "Wow, really, man?" Like, "Yeah, man, I'm going through some stuff," and come to find out, man, all of us were pretty much going through the same thing. And I said, okay, we ought to have something about this. So we started learning more about it. And since then, I've been teaching about it periodically. But tonight, we're going to go through this. And this is basically menopause 101 for men and for women, but for men. We want men to be supporters of their significant others through this. So we're going to talk about 5 key talking points that will help us deal with this tonight. Is that all right? So go ahead and tell somebody, man, they talking about some deep stuff. Y'all ought to listen to what's happening today. Um, so menopause, and I'm going to give my um, view of the research that I got. and of course, the
I'll
expert
just
will chime in.
now I am not an expert, but have personal experiences, and so I can help
Yeah, we're gonna we're gonna talk
out.
about some of our experiences. So menopause is a significant life transition for women, and understanding it can help men be more supportive partners. And we're going to talk about 5 informative and impactful talking points that we aim to educate men about what menopause is and what women experience and how the brothers can help. Now, each one of these points is backed by um, expert insights, and these are quotes from medical or psychological professionals. So there's some research that has gone into this, and the whole tone of this is to be supportive, and it's aimed at fostering empathy and understanding. Okay, so number one, we need to understand that menopause is a natural biological stage. It's not a disease. Your wife, your significant other, is not mentally well. There's some mentally unstable stuff that takes place because of it.
And it's not mental instability.
Yeah, it's not
Let me
mental
stop you
instability.
right there.
Yeah.
It is not mental instability. It can affect your emotional state, but mentally, you're well. You're just having some hormonal changes that might affect your emotional state, your thought process. However, you're mentally healthy. So, as you stated, it is not an illness.
It's not an illness.
Right.
It's not a personal failing. Okay, it's a normal biological phase that every woman goes through as she ages. What it does is it marks the end of a woman's reproductive years, defined by 12 consecutive months without a menstrual period. So just right there, we ought to really look and understand that part, because that's a tough one for men and women to deal with. Um, it marks the end of a woman's reproductive years. That means that am
No
I
more,
right?
exactly. No more
No
children.
more children.
What is happening is your ovaries are no longer, or will soon no longer be able to produce eggs, and therefore you are not able to become pregnant. And so it is the decline of that part of your hormonal system that is meant for a reason. We're not, when your body becomes not able to sustain a pregnancy after a certain age. And it depends on, well, it varies with different women.
So they say that the average age of menopause is around 51 years. Typically, it occurs between 45 and 55.
Now, may I add something? Because
Absolutely.
some women may experience menopause earlier in life. Me, for an example, I experienced it at age 40. That's not really considered early. I think late 30s are early, but just so you know, if you are having any symptoms that you think may be menopausal, it is important to get in touch with your doctor or be seen by your doctor so that they can tell you what is actually happening with your body if you are or are not in menopause. So it can happen as early as 40, late 30s. Now, that usually happens if your mother or her mother or both of them experienced menopause at or around those ages, 30s, but typically it's between 45 and 55.
Mm. So this change happens gradually, as was stated, because the ovaries they stop releasing eggs and they produce less estrogen and progesterone as the body ages. Wow, I'm throwing out them big words tonight, huh?
Estrogen and progesterone.
Wow, wow.
Excellent.
So this OBGYN, Dr. Jen Gunter, she emphasizes that menopause isn't a disease. It is an evolutionary adaptation that is part of the survival of the species. And I want to emphasize that because I have seen where men, because of the lack of understanding of what a woman's body is going through, they have they really misunderstood what this whole process is about, and they have criticized, um, characterized it in a negative way. And tonight we hope to eliminate all of those misinterpretations that are out there, or this characterizations that are out there. Um, Menopause is a natural part of life. It's not something abnormal. About half the population will experience it if they live long enough. And it's stated by 2025, over 1 billion women worldwide will be in menopause, reflecting how common this stage is. That means that your air conditioning bill will go up in the winter, and your heating bill will go up in the summer.
Mm.
Yeah,
Okay.
I know it's so much. I'm sorry. I'm
Okay.
sorry. I'm sorry.
Okay.
So, Forbes, it's reported in Forbes that understanding this biological reality, it can help men approach menopause with more respect and less fear. It's not her fault, or something needs to be fixed, but it's a natural transition that can nevertheless bring real challenges. And listen, let's just be honest. I'm going to be transparent here. It was strange to me. It was strange to me. I saw signals that I didn't know what was going on. It was can I tell the New York story?
You go right ahead.
So
You tell it.
during this time,
Don't make it too
yeah,
specific.
I,
Because
I
I don't really know, so I just want to hear what you
I
have to
can
say.
remember we went to it was our anniversary, and we went to this Italian restaurant that was hard to get in, and you had to know somebody who knew somebody to get in. And we went to Little Italy, and we went downstairs into this little Italian restaurant. And man, the waiter was, just coming over to us and feeding us and letting us taste this, letting us taste that. Man, we were having a great time. And we were walking back to our hotel. We had a beautiful hotel overlooking Central Park. It was the bomb. And all of a sudden, I heard this crying. I was like, and I looked over, and Karen was crying. I was like, man, what is going? I thought somebody had said something to her, and I'm looking around like, man, am I beat somebody down? I'm sorry, or give a two piece to the throat to somebody. And I was like, what's going on? And it was like, I don't know.
I have no recollection of that.
I'm sure you don't, but I do.
Okay.
Um, and it was during that time, and it just, it's just one of those things. And I just wanted to know what was going on because I knew something was going on. I knew something was happening. I knew it wasn't me. I didn't do anything. But in learning about this, um,
No.
we were able
So
to.
so let me tell my recollection of that. We had a good time. We It was beautiful, wonderful weather. We ate. We had some adult beverages, and we went home. I don't remember whatever you're talking about. I have no
See,
idea.
see,
I don't remember that.
see. So that's one of the things that menopause will do.
Okay.
So, number two. Ooh-wee, help me, y'all. Come
Yeah,
on,
help,
comment,
somebody
comment.
help him.
Somebody comment. Let me know you're listening.
Help him.
Let me know that you have gone through this with your wife, your significant other, so that I know you're there. So anyway, so number one, we talked about menopause is a natural biological stage. It's not a disease. And I want everybody to understand this. I want the brothers to understand this, that it's nothing wrong with your wife. It's nothing wrong with your fiance or significant other. It's natural. It's natural, man. And the more you learn about it, the better you're gonna be. Hey, brother Denson, I'm so glad, man. So glad. Thank you, man. I need your help on this, man. I need your help, brother. Um, so number two, menopause, it brings real physical and emotional symptoms, as you heard me us just joking about this. The menopausal transition, including peri perimenopause,
Perimenopause.
perimenopause,
Meaning around. Peri.
okay, perimenopause.
Mm-hmm.
The years leading up to menopause.
Yes.
It can cause a wide range of symptoms that are both physical and emotional. And believe me, my brothers, these symptoms are very, very real. They result from hormonal fluctuations, especially the drop in estrogen, and it can significantly impact a woman's daily life. Common physical symptoms include hot flashes, sudden waves of heat, night sweats, disrupted sleep, vaginal dryness, which can cause discomfort during sex, and changes in weight and metabolism. So sure, please do. Help me, help me, help me.
Okay. So I just want to say, in all of what you just heard, for women, now just think of all of what all of what he just read to you, what they could possibly be going through physically, emotionally, and mentally. Many times, some women don't know that they're having perimenopausal symptoms. This is not yet menopause. These are the symptoms leading up to menopause. So they may not all happen, as he read out, all at once, and they may not happen consistently. It may be off and on, off and on. I know for me, even being a nurse, I didn't realize uh, what was happening, because these symptoms can start occurring as early as in your 30s and 40s. And so you may be having some symptoms due to hormonal changes early on, and you're not really sure like what is happening, especially those hot flashes. I mean, we relate that to menopause, but you may be in your 30s and suddenly feel these symptoms and not really connect that to menopause because you're still in your childbearing age. But I want to say this as well, so important, because we mentioned emotional state. Menopause for older people. I don't know about people my children's age or a little older than them, but for older people of my age, it was taboo. Menopause was not to be talked about. It was shameful. One, it was almost like not wanting someone to know because you're getting older, not wanting to tell your age, for some women. And so I'm saying that because you have to understand, if you're thinking that your partner, or if you yourself are going through menopause, it is so, I'm going to say this again, important to find out what exactly is happening to you. Doctors can help you understand if you are or are not in perimenopause state or in that phase. But I want to say to your significant other, please be careful about sharing this because it's a very sensitive and private experience for the woman. It's a very you may be confused, and two, it can be embarrassing. It can be embarrassing. I know when I started menopause or really realized I was in menopause, I did not want to share it with people because it was kind of embarrassing. I can't exactly tell you why. I know it's a natural, especially being a nurse, I know it's a natural transition in your life, but you just don't want to share that. I mean, because when people start fanning and oh, you're going, they make it like you said, something that is
It used to be the thing. Oh, you're going through the change of life,
yes, you're
going
going
through the
through the
change,
change,
or you're having a storm.
And so that means I'm getting older. And for some women, getting older is not a desire. They don't want you to know how old they are, one. And two, if you say I'm getting older, then that causes an emotional reaction, if you can understand that.
Yeah, yeah.
And so if I'm sorry, I didn't mean to cut you off. But if you want to talk to someone, you have a buddy group and you want to talk, and this is for the men, and you want to talk to someone, I would caution you. I would say first talk to your spouse or your significant other or that person that you're sharing your life with and ask, hey, what's going on? What do have you seen a doctor? Or just ask about them. And see if they don't mind you sharing, because for men, they do need to speak to other men for their experience. How are you handling this? So later I see in your information, you're going to share what can be done to help. But I just want to caution you to be very, very careful about who and who you're sharing it with and how you're sharing it, or even if that your wife or your significant other wants you sharing it. I know I did not.
Yeah, you know what?
It was hard. That was hard.
Thanks for that. That's very important, and I'm glad you brought that out. As a pastor, I often talk about every young man needs an older man in their life, and every older man needs a young man in their life because they need to be able to help with growth, help with maturity. And this is one of the areas that we can help one another with. I never forget one of the conversations I had with one of the brothers. I said, man, what's going on, man? And he said, man, I don't know what's going on, man. I looked up one night, man, my wife had her head in the freezer, man. Just had her head in the freezer. And I'm like, wait a minute, what? She said, yeah, man, she just had her head in the freezer. She said, I can't get cold. I'm just hot.
Can't cool off.
Yeah, I can't cool off. So she just put her head in the freezer. And then, a lot of brothers have shared the experience of in the middle of the night, the wife starts taking off their clothes, and the brothers think that, oh, okay, this is
the sign.
This is a sign,
we're getting intimate.
Yeah, we're about to get intimate because just out of the clear blue, man, is ripping off clothes and stuff, and then brothers went to go touch, and it was like, oh my gosh,
yes.
what's going on? Like, so they were confused because men, we are, hey,
one track mind.
Yeah, sometimes we got one track minds. So, we see our wives as our significant other, well, our wives. And all of a sudden they start taking off their clothes and okay. But that's not it, brothers. That's not it. And listen, talk. When that reaction takes place, I mean, you're just natural. Okay, you married, that's your significant other, and you see your wife, your girl starts taking off her clothes, and you think like, okay, and then the reaction that you get from the negativity or
the
push away or the rejection, you feel some kind of way. So, the natural thing, I'm not going to say the natural thing, but right away you start thinking to yourself, well, what's going on? What's happening? And that's when you start noticing, man, I need to talk and see what's happening with this, because there's something going on with my wife, my significant other, that I'm not understanding. And I need some explanation. And really, your spouse may not even be able to explain to you what's happening, because it's all happening so fast. Am I right?
Yes. I'm just hot. I just that's how you feel. I'm just, oh, just let me get air. It's almost like suffocating. And it's sudden and it's intense.
Yeah.
So
Yeah.
it you don't want you're trying to get things off of you. You don't want somebody to come and block that air you're trying to get.
Yeah. And it's it's snowing out, and your wife is fanning, and you're like, what's going on? It's crazy. So it's really important. It's really important.
Let me touch on that fanning thing as well. Because I've seen some husbands being so supportive, and wives have told me that is so embarrassing. Stop doing that. They'll notice that their wife is they're in a public place, and they notice their wife is kind of doing this kind of thing. They know, okay, she's starting to get hot, and they'll start fanning her, and it's like I said, it's a very personal thing. It's embarrassing for some women. I would, I would appreciate that. But for other people, that may be embarrassing. So, if talk with your wife, your significant other, and just go over what would be okay for her or appropriate for her.
Yeah.
Let her guide you.
Yeah. It really, guys, I can't emphasize this enough. And for the sisters too. Talk. Talk. It This is a time where communication is key, because nobody knows what's going on. All of a sudden, the sisters are going through all of these different emotions and physical interruptions, and the brothers don't know what's happening, because the normal flow of what's happening in your life is disrupted by this thing called menopause. And I've named it "Men Ought to Pause." Men need to learn how to pause. Um, one of the articles I read in an article from healthywomen.org, it says that many women also experience headaches, joint aches, or fatigue during this time. So your wife can be tired,
Hmm.
irritated,
And
headaches.
anxiety is high. Um, because of the decline in estrogen, which is so important to so many of female function, your self-esteem, because of all that's going on, and your self-esteem, your self-confidence, um, reduces. It decreases. That's because of the reduction in production of estrogen and progesterone. And so you start to feel anxious out of nowhere or unsure, foggy mind, and all of this together affects your ability to function. And you may be on a job, and you've done this job for a long time, and all of a sudden you're nervous about it. I know that happened to me. Very nervous, like, and almost unsure, and that has to do with hormonal changes.
So, brothers, you are you hearing it firsthand, and just imagine what a woman is going, or if maybe you've gone through this, and now you can say, "Yeah, that's right," and never thought about explaining this to your younger sons or nephews or grandkids. Share this. This is very important. Sister Leah, thanks for watching, and yeah, we appreciate that. You appreciate that we're sharing this. It's so important. It's so important. Healthywomen.org, they state that emotional and cognitive symptoms are also frequent. Are also frequent. Mood swings, irritability, anxiety, as Karen just stated, and even depressive feelings can occur, along with that brain fog or trouble concentrating. Um, Man, this is nothing to play with. I've known guys that were on the brink of divorce. My sister Hope, good to see you. I know that
Hey,
there were couples
Pastor
that
Hope.
were on the brink of divorce, separation, and everything else only because no one talked about what was going on. No one talked about what was going on. The woman, the wife, the significant other, they were going through menopause or perimenopause, and all of these changes that we've been talking about tonight, the emotional and cognitive, the mood swings, the irritability, the anxiety, the sudden waves of heat, the night sweats, disrupted sleep, vaginal dryness during sex, changes in weight and metabolism. I mean, just think about that. Just think about that. I mean, that has a multitude of mental things going through a person's mind, and then you, as the supportive husband or significant other, trying to figure out what's going on, and no one is talking. You're not trying to find out what's happening, and all of a sudden you start coming up with things that, oh, she must be cheating, she doesn't want me, oh, something must be wrong, I must have done something, maybe I'm not attractive, maybe I'm too fat, maybe I'm too skinny, maybe she just doesn't like me anymore. And now, because nobody is talking and everybody is assuming, that's the trick of the devil. That's fertile land for the enemy to come in. So another thing I need to express in this is prayer is essential during this time. Okay. Um, one of my prayers was a prayer of discernment. God, help me to understand what's going on, because I want to know what's happening, because I don't know what to do. I don't know what to say. I don't know what to think. Like, help me, please. With no real theological prayer. It was, look, help me, man. Um, Another thing that is stated is that around 80% of women will experience some uncomfortable menopausal symptoms. Though the type and severity of symptoms vary for each individual, 80% will experience some uncomfortable menopausal symptoms. So your wife is going through all of this stuff, and you see a change in who they are, and you can't just get angry or mad or thinking something's wrong. You gotta talk. You gotta talk. You gotta seek help, and really, you need to talk to one another, because your wife may not even be able to explain to you, and the only thing she may be able to say is, "I don't know what's going on. My body's going through some stuff. I think it might be menopause." And then that's when you get on the internet, get some books, talk to some support groups.
Go to your doctor, make sure that's what's happening. Could be
Yeah.
something else.
Wow.
Can I say this?
That's big. That's big.
Because it happened to be so early, and I didn't expect it to happen that early. I put my symptoms off because I used to work at night. Do you remember that?
Hmm.
And I thought it was just the stress of working where I was working. I worked from 7 to 7 in the morning. So 7 at night to 7 in the morning. I thought my circadian rhythm was thrown off. I thought it never occurred to me, and even being a nurse, it never occurred to me, this is the start of menopause. This is perimenopausal symptoms. Um, because I was having some of those symptoms when I was in my late 30s. When I thought back, I realized that. So, it depends on what's going on in your life for you to recognize, oh, this could be that. You have to put a couple of symptoms together and think, okay, this is what it could be. So women, pay attention to your body. Stay in touch with your doctor. Get your physicals, especially if you're 40 and over. Get your physicals. They can tell you what is happening,
Yeah,
and what to do.
that's real good. Reverend Hope, be careful because some medications may trigger negative side effects. Yeah.
Yes, I was going to touch on that too, because you'll hear a lot about different natural ways to minimize the effect of perimenopausal symptoms. But again, you need to talk with your doctor. Thank you, Dr. Hope, because you can share whatever you plan to do with your doctor and help and let them guide you. Also, if you're having symptoms, write them down, and then share that with your doctor. Write them down, when they occur, what has been, what occurred at that time, and what you're doing, what you're taking, if you're taking anything. But I would caution, don't take anything until you talk to your doctor.
Yeah, talk to your doctor. Talk to whoever you need to get a first, a second, and a third opinion.
Yes.
It's that important. Trust me, I've seen this happen, and I have seen major damage. I have seen major damage happen to couples because of the lack of communication, the lack of empathy. Look, here it is. I'm a witness to premenopausal from surgery.
From surgery.
Yeah,
Yes.
thank you,
Mhm.
thank you.
And I hope I'm thinking that person has a lot of guidance. Who is that?
That's Reverend Hope.
Oh, okay.
Uh-huh.
My sister.
It's important for men to recognize that these hormonally driven these things they're hormonally driven, and it's not all in their head. Sometimes you want to say, listen, this is all in your head. You're going to be okay. You just stressed out about work. You just stressed out. Now, there's some women who have small children who are going through menopause. So you got children you're raising.
Yes.
You got a husband. You got a family. You got a job, and now all of this is going on. Dr. Catherine Jordan explains. She says estrogen affects us everywhere. When our women, estrogen affects women everywhere. When women's estrogen levels deplete, it can affect women all over, from the joints to the skin to the brain. So I'm really pointing this out. We're really pointing this stuff out for brothers to understand the seriousness of what takes place with a woman physically and psychologically during this time. It's very important that you have patience. It's very important that you ask for the same amount of grace that you would ask God to give you as you go going through something. Because brothers, we get a thumbtack in our finger, and we curled up ready to go see Jesus. So think about what's going on with a man. There's another part of research that I read where okay, Reverend Hope, you didn't have to agree that much. This means the decline in estrogen can influence virtually every system in the body. Yes. Which is why a woman might simultaneously have hot flashes, achy joints, and memory lapses. Research confirms that almost all women will experience menopause, and the symptoms can have a severely detrimental impact on their quality of life if it's not managed. And men should take these symptoms seriously. For example, frequent hot flashes at night can lead to chronic insomnia because they've been up all night, they're sweating, they're taking their clothes off. The brothers are looking and they're going, oh, okay, this is my time. All of a sudden you go to touch them and they become
they just want you not to.
Axe murderers.
They do.
And then
see, now that's an example of you calling us crazy. We are not crazy. We just
I'm
want
sorry.
air. That's it.
I'm sorry. They just
We
want
just
air.
comfort, air and
And
comfort.
then, you go to turn the air on and turn the fan on
And we want it all.
because you're showing empathy, and then you get back under the covers, and all of a sudden they're crying because it's too cold.
Exactly.
And you turn the heat on, and you just got to sleep. Both of you been up all night going through this. It's too hot. It's too cold. It's too
Is that
hot.
what happened
It's
to
too
you?
cold.
Because I
And
never acted like
and
that.
then all of a sudden, no, not you. No, not at all. These are stories that I've heard.
Hmm.
And then all of a sudden, it's time to get up in the morning, and
Oh
both
my
of you are
God.
tired.
And so I kept you up
Oh
all night.
no, no, this didn't happen to me. No,
Oh
I'm
my
talking about
goodness.
all the stories that I've
Yeah,
heard in
of
my
course.
research.
All right.
So, moving on. Men should take these symptoms seriously. Okay, it's patience and understanding um, of these particular symptoms is key. Um, your significant other isn't choosing to have them. This ain't a choice. This happens, um, and often she will find them frustrating as you do, just as frustrating as you do. Okay. Woo, time is fine. All right. Number three, it can affect. Are y'all getting anything from this? And excuse me, I'm a clown. I don't, but I wanna bring a little humor to this, bring it up a little bit because um, this is real life, y'all. And if you're not careful, if you don't pray, if you don't communicate, if you don't seek help, if you don't look for an understanding of what's going on, you're gonna have some problems. I'm telling you, you're gonna have some problems. I've counseled enough brothers during times of their wives and significant others going through menopause that this is why I have spent my time today, and we have spent our time today doing research on this so that we could communicate to you because you know what I always say: meet needs, solve problems. We're trying to make this. We're trying to make our audience better. Okay, that's our goal. So number three, uh, number number one was menopause is a natural biological stage. It's not a disease. Number two, menopause brings real physical and emotional symptoms. Number three, it can affect intimacy and your relation dynamics. Okay, we talked a little bit about that, but let's go deep into this. Menopause doesn't just impact women; it can also affect relationships and intimacy. The shifting hormones and symptoms may change how a woman feels both physically and emotionally with a partner. For instance, lower estrogen levels often lead to decreased libido and vaginal dryness, and making sexual intimacy more difficult or uncomfortable. In fact, research says that 47% of women experience sexual difficulties around menopause, with reduced desire being the most common issue. So now, a lot of times, the way this wave and this cycle goes, when women are premenopausal, perimenopausal,
Perimenopause, not
perimenopausal,
pre. Perimenopause.
perimenopausal,
Hmm.
menopausal, men are almost at their peak of sexual trials or sexual they're at the peak.
I'm gonna let you go with that because
Oh, you just
you the
left me out
man.
there. Wow.
You the
You see
man.
how
Explain
she just
it.
threw me under the
Explain
bus.
it.
Wow. Help me out, brothers. You know what I'm talking about.
Okay, I think we all do.
So you at your sexual peak
Hmm.
and you're like, wait a minute, we are married. And the Bible says that the bed is
Undefiled.
undefiled, and the Bible says that you are my wife and you are this and you are that, and we start preaching and becoming bishops overnight because we are there and she is not. So you see how this goes. I'm sure that I could have explained that in a much better
I'm
way.
sure everybody understands.
I'm sure
So, so,
everybody
so
understands.
let me say this about that. Okay. So now you're not the only one, men.
Yeah, Calvin, you're right. She gave me that look.
I'm just saying you're not the only one who okay, so the female's libido may have decreased, but you're, for me anyway, you're my husband. So it concerns me that it was like a feeling of guilt that I don't have the desire. It was nowhere to be found. And I didn't, it was hard because I didn't want our relationship, well, our intimacy to be affected in that way. Like you said, you're at the peak. I want to be at the peak with you. I love you. So I am, I'm feeling guilty because it's like when you just don't want to eat and you have no appetite. You just don't desire it. What do? How can you keep that intimacy or that fire going? And it works on your mind. It's like, oh my gosh, I can't allow this to happen in my marriage. And it makes it hard. You stress about it. I know I stressed about it because I did not want that for us.
Mhm.
And intimacy is a very, very, which I know, and everybody else does, in a relationship, a loving relationship, is a very important part of that relationship.
Mhm.
It is, the human touch is like a medicine.
Mhm.
And so I did not want to deprive you of that.
Mhm.
It's like a medicine for the both of us. It
Mhm. Mhm.
helps seal the relationship. It helps to make things better.
Mhm.
But I also want to say there are other ways to be intimate.
Mhm.
Like you could just hold my hand,
Mhm.
or you could just rub my back. And you know what? Sometimes that eases that feeling of low libido. It
Mhm.
helps to get the fire going again,
Mhm.
if I
Mhm.
may say, because the Lord wants us to desire each other in that way.
And Lord also wants us to understand and understand what our wives are going through. Um, and so yeah, you see that. Kiva, how you doing? Bailey, how you doing, man? Good to see you
Hello.
guys.
Hey, everybody.
Um,
Hey, sister.
so healthywomen.org, it states that this whole thing about menopause can be challenging for couples. Men might feel confused or even rejected if they aren't aware of the biological reasons behind these particular changes. And it's important not to take these changes personally. I can't stress that enough. You can't take these changes personally when your wife is going through this particular time. That's why you got to understand, you got to talk to some people, visit with your doctor, talk, brothers, talk to some of the men at your faith institution, wherever it may be, your mosque, your synagogue, your church, wherever. Or if you just got a men's group. I mean, I've got a men's group that is not part of a church. I got a men's group that's part of a church, and we talk because we want to be better. And this thing of the lack of estrogen, as we started stated before, can cause pain during intercourse or simply lower a woman's interest in sex. And it's not because she's no longer attracted to a partner, but because her body is going through a drastic change. And we need to understand that. And beyond the bedroom, mood swings or depression during menopause can lead to tension or miscommunication in relationship. A woman who's experiencing anxiety, irritability, or episodes of feeling down, they may withdraw or have a shorter temper. And this can, understandably, it creates stress in a marriage or partnership if the husband or partner isn't prepared for this. One therapist noted that if both partners are going through midlife changes, women with menopause And men with their own midlife adjustments, like gradual testosterone decline, the relationship may be on an emotional roller coaster if it's not handled with care. Yeah, brothers, y'all, we go through this stuff too. Okay, we go through a midlife crisis. You know, some of us go out and buy convertibles and healthywomen.org says that good news is that with understanding and open communication, menopause can actually bring couples closer. Women who have a supportive partner often have a smoother transition through menopause. When she is happy, he is happy. One menopause expert writes, and that's true. I mean, you got to talk, man. You got to talk. I became somewhat of an expert on this. I can talk to a brother for a moment, and within the first 5 minutes, I know exactly what's going on. I know exactly what's going on. As I pastored, I would see women, and I would see certain things happening, and I was like, "Oh, I got it." So instead of viewing menopause as a wedge between you, think of it as uncharted territory that you can navigate together. Many couples report that facing the challenges of menopause as a team is strengthening their bond. As you can see right here, we're doing this as a team because we want you to win, because we won through it. The key is to stay communicative and compassionate. Okay, don't go crazy. Don't die on that mountain. Talk about what you're both feeling, and remember that you're on the same side. Okay, if you know you didn't do anything wrong, you know she didn't do anything wrong. You must know that there's something wrong, and it don't have nothing to do with either one of you personally. Somebody's going through something. So with empathy, a sense of humor, and mutual support, your relationship can not only survive menopause but emerge even stronger. So make sure you keep ice in the refrigerator. Make sure you get up and be energized to run down there and turn that air conditioner on, turn that fan on. Um, yeah, all of that. Okay, like what? What do you see that's happening? Okay. You want to add anything to that?
um
We got about 10 more minutes
10
before we wrap
minutes.
up.
Okay. So good job in understanding. Um, and I do hope that this was helpful. Um, I think that when you care about each other enough, um, you do seek to find out what that person is going through. Just being patient, being as open and understanding as possible. And maybe you have to nudge your wife to see the doctor. Maybe like I said, it didn't occur to her or saying, "Hey, I noticed that you're doing this or you're doing that." So it is good to be supportive, and when you have a supportive and loving person in your life, then you can feel comfortable with getting through this stage of your life.
Yeah, Reverend Hope, that's a good question. Do men go through the change?
Yes.
Yes. Yes. Yes. And
It's a decline in testosterone
it's just as mentally
and
and
emotionally
um emotionally and mental challenging as it is for you guys. It is. Yes, we do. Um and
And again, talk, men, because men don't like to talk.
yeah.
They don't even. I feel.
Yeah.
I'm sorry. Sometimes they don't.
No, that's real.
They don't want to
Because that's
get
embarrassing
too far,
also.
and also for our issues, you don't want to get too far in it. She's so emotional. I don't know what to do. I don't know what it is, but men keep their emotions in, and I guess you're taught to do that.
Yeah, I
Hmm.
mean, that's why they go buy a convertible. Yeah.
Yep.
Oh, I want to say something else to that, but I don't want to get in trouble. Oh, Reverend, I hope you're gonna get me in so much
At
trouble
60.
at 60. Oh, you're gonna get me in
True.
trouble. That's
Yep.
true.
Kiva. Yep.
That's
Kiva.
true. We do. We
Hmm.
go through this change because all of
Hmm.
a sudden we're feeling like, oh, I'm getting old. So, yeah, it happens. Oh, I have so much to say about that, but I'll get in so much trouble. But yes, we do go through it. Yes, and it's like, oh gosh, man, you just want somebody. Men just want somebody to say you still got it,
And so do women.
and so do
And
women.
that's why you should say to me, and I should say to you, you still got it. Don't I tell you that all the time?
Yeah,
Yes.
yeah.
Big tall child.
Watch it now.
Glass of milk.
How number 4? We are running out of time. How men can support their partner through menopause. Men often wonder what they can do to help their wife or their partner during menopause. The most important thing is to be supportive and informed. Start by educating yourself about what menopause entails. The fact that you're reading or listening to us right now is a great first step. And if you guys want us to come out, you want me to come out, talk to your men's group, no problem. I do it. This is what I do. Knowledge will help you anticipate what she might be going through and show her that you care. Menopause counselor Diane Dazenbrink advises the more you know about what she's experiencing, the better. Many women feel lost and lonely at this time in their lives, and your love and support is more important than ever. In practice, being supportive means listening and empathizing. I can't say that. Um, I can't say that enough. It means listening and empathizing rather than trying to fix her. Don't try to fix her. Don't try to. Well, go get this medicine. Go do this. Go do that. Don't be the Google doctor for your wife. Don't do that. Don't go doctor.com on Google and say, "Hey, I read this." Get some real information from some real professionals. Sometimes she may just need to vent or to cry.
Oh my gosh. You
Be
look.
patient and avoid telling her she's overreacting. Please, Lord, do not do that. Menopause can be deeply unsettling for a woman. Knowing that her partner hears her and has her back is enormously comforting. Here are some concrete ways that men can provide support. Practice patience and understanding. Her mood swing, or she might get irritated more easily due to hormonal shifts. Instead of reacting with anger, take a deep breath. Fluctuating estrogen levels can result in a sharp tongue sometimes. So you may get called some names or some things may be said. Some things may be said. And, sometimes you might, after the hormonal thing is over, you might want to go back and say, hey, I dealt with this when you were going through your change, but I want to say that I don't think well, I'm not even gonna do that. So
Hmm.
it's wise to just stop, breathe, walk away if you have to. It will pass. It will pass. Thank you, Dr. Holt. Thank you. Thank you so much. Um, so yeah, have empathy, y'all. Have empathy. Okay, real quick, let me get to number 5. Oh, let me get to this because this is important. Don't put pressure on her and don't take things personally. Understand that she isn't in control of symptoms like low libido or fatigue. Avoid pressuring her for sex or demanding that she snap out of a mood that will only add stress. Give her grace on the days that she has to cancel plans or needs extra rest. Brothers, man, chill out. Chill out. Seriously. You're going to make things more difficult. See, here's the thing. This too shall pass. This too shall pass. It will pass. And when you get to the other side, you want something to be salvageable. Like, you don't want it to be so much damage in the midst of what's going on that when your wife, your significant other gets through this, there's nothing left because you've done so much damage. You said so many horrible things because your lack of empathy or your lack of of understanding or your babiness. You just wanted to do it when it was time to do it, that you thought it was time and she didn't, and you blame that for going out and doing something else and all that. Come on, man, pull up, bro. Really, don't. If that's your wife, that's your one. Find out what's happening, man, and have some empathy. And if empathy has changed, intimacy has changed, have an honest but loving conversation about it. Don't interrupt a lack of interest in sex as a lack of love. Love. Often with the right medical help like lubricants or hormone therapy and patience, couples find new comfort zones. So, this could be something for you to find out that, hey, I didn't know this was even available. Encourage her to seek medical help when needed. Um, if her symptoms are severe, for example, debilitating insomnia or depression, support her in talking to a healthcare provider and go with her. Go to the doctor. Be with her. Sit with her. Okay. All right. For the sake of time, we got to get to number 5. Man, holy cows, 8:01. Please stick. I'm going to take 10 minutes. Stay with me for 10 minutes and I'm going to get out your way. Empathy and understanding are key. Above all, empathy is the most important thing men can offer during a woman's menopause. Empathy means truly trying to understand her perspective, recognizing that even though you as a man will never experience menopause firsthand, you can appreciate that what she's going through is profound and challenging. Put yourself in her shoes. Diane Dazenbrink encourages men to try to imagine what it must be like to have so many physical and emotional changes happening at the same time and to be wondering where the real you has gone. That's what the woman is. She's trying to figure out where am I?
What happened?
What happened to me? I'm not there anymore. And she's trying to raise children and she's trying to work and
trying to be your wife.
Trying to be your wife all at the same time. And all you thinking about is. So, guys, be empathetic. It also means showing compassion when you don't fully understand her experience. You might not know exactly what a hot flash feels like. Oh, but you will. Or what it's like to suddenly feel anxious for no reason. But you can see that it's hard for her. Avoid avoid jokes or minimizations. Don't.
That one went out the window.
Yeah, that one went out the window. I didn't do too well with that. Don't tease her about women problems or dismiss her symptoms as moodiness. Didn't do too well with that. But what may seem minor.
Should have read this article a long time ago.
What may seem minor from the outside can feel overwhelming to her on the inside. Instead, just acknowledge her feelings by simply saying, "Hey, I'm sorry, my bad. I'm sorry you're going through this. It sounds really tough." That can be incredibly comforting, you know. Anything to add as we close?
I do want to say, Jeff, you were very supportive after you realized what was happening. You were very, very supportive. A thing that he used to always tell me is, I still desire you. You are still beautiful to me, no matter what was going on, because your body is changing and you're looking way different than you did when you first met. Because as the low estrogen levels changes your skin, your muscle mass, all of that, you're gaining weight. But you were always very supportive and loving. And one thing I noticed the article says, tell your wife she's beautiful. Tell her, give her compliments and, do special things.
You're beautiful.
After
You want some water?
After you done made jokes and stuff. Do I want water? Mm.
Hey guys, listen, I've certainly appreciated this. I hope you
Thank
got something
you.
from this. Thank you. From the bottom of our hearts. Yeah, Kiva, she still look good. You got
Thank
that.
you, sister.
From the bottom of our hearts, we want you to be better. And that's the
Yes.
reason that we do what we do. We love you and we want you to win. And sometimes people don't want to be personal. You know, we bring on guests, we bring information, but sometimes you have to share your own experiences for others to understand things personally and help them in the process. So
Yes.
we hope you got something from this. Thank you for tuning in with us. Thank you for staying with us. And we hope to see you next week.
Subscribe.
Oh,
Hit
make
that
sure
like
hit the
button.
like button, subscribe if you're watching us on YouTube. Hit the link, the subscribe button, the like, because a lot of times I do something throughout the week if there's some information I think you need to know. And tell somebody to tune in. You can go back and see this stream on all of those things, LinkedIn, Facebook, and YouTube. But we love you.
We love you.
Go out and
Thank
meet
you.
needs, solve problems.
Love you
And
all.
man, listen, pray for me because I'm still I'm still learning about this. Yeah, I'm still learning. And yes, men do go through the change,
Yeah.
and we do buy convertibles.
And I'm good.
See ya.